Welcome to the Joint Replacement Club at Northeast Baptist Hospital. My name is Melissa Johnson and I am the orthopedic liaison here at Northeast Baptist. We are proud to say that we have been a center of excellence for total knee and total hip replacement since 2010. I will be leading your Joint Club class today. The purpose of this class is to teach you a little bit about what you can do before to prepare for surgery, about your surgical experience, and what you can expect during your recovery here in the hospital. At the end of the video, we'll have a little quiz to test your knowledge on the Joint Club class. If you have any questions, we'll have time after class to answer any questions you may have. If you're viewing this DVD at home, we will have phone numbers available for you to call if you have any questions. We'd be happy to answer any questions you may have. First, let's talk about some things you can start doing now to prepare yourself for surgery. You should have received a guidebook from your surgeon's office. There is a knee and a hip guidebook. If you have not received one of these, please contact your surgeon's office to get one. You can also go to bhsjoints.com and you can download one from the internet. It is very important that you start reading this guidebook. There's a lot of good information in the guidebook, so please read this guidebook front to back before your surgery. It will probably answer a lot of questions that you have. Our goal is for everyone to transition home safely, so it is very important that you create a space in your home that will allow you to do so. You will be using a walker for 6 weeks, so one of the things we recommend is that you create a safe path through your home that the walker will fit through. We also want you to pick up any throw rugs that are on the ground or any extension cords or cords that are along the path that you will be walking. These are trip hazards and we don't want you to fall, so please make your space safe. You will find a picture in your guidebook that has a bunch of reminders of things that you can do to make your place safe. We also recommend that if you have a chair or a space on your couch that you like to sit that's low, that you put some firm pillows on the chair or couch to help elevate where you're sitting. It is much easier for you after surgery to get up from a higher space than a lower space. It is also recommended that for footwear that you use rubber-soled shoes or non-skid socks. We really don't want you wearing flip-flops or any kind of sandals with no backs. These are also trip hazards. It's easier to trip in this kind of shoe, so please prepare yourself for that. If you take a look on the next page, after the living room safety picture, you will find a checklist of things that you can start doing to prepare for your surgery. It'll have the safety items listed on there, but also things that you might not think about. Make sure that you have enough groceries. If you're going to be home alone, prepare some frozen meals that'll be easy to eat when you're home. Also, arrange for your mail, someone to pick up for your mail for you. This is just a good little checklist of things you might not think about to do before surgery. 5 days before surgery, you need to stop shaving on your operative side. It is very important because we don't want any microscopic or tiny nicks or cuts in the leg that could present opportunity for infection. So please, 5 days before surgery, no shaving on that side. They will use special clippers to clip the hair in the operating room. There are a few things that we recommend that you bring with you to the hospital. First, we recommend that you bring 3 loose changes of clothing. Anything that is comfortable for you that you like to lounge around in the house. We don't recommend anything like pants that's tight and restrictive. It could be athletic wear if that's what you like to wear. Pajamas is perfect as well. Ladies, sometimes we like to wear dresses to be comfortable, but we will be in a group setting during physical therapy, so remember, below the knees would probably be best. We also recommend that if you have obstructive sleep apnea that you bring your CPAP machine with you. Please bring that. Toiletries, we have all the basic toiletries here in the hospital, but if you would like to bring your own, you're more than welcome to. We also recommend that if you use eye drops, please bring your eye drops with you. All the rest of your medications can be left at home. We have most of them here in the hospital. You are more than welcome to also bring your cell phone with you, but please leave everything like laptops and tablets, please leave those at home. We don't want any valuables here in the hospital. So the day before your surgery, you have been instructed to be NPO, or have nothing by mouth after midnight. That is very important, and that includes no candy or gum after midnight. Some of you have been instructed to take a medication in the morning. That's okay. Please take that medication. Just use a small sip of water to take that medication. Everyone should have received a bottle of soap from their pre-admission testing nurse. If you have not received the soap, please get in contact with us and we can get you one. This soap is very important. It helps prevent infection by washing away bacteria on your body. So the night before your surgery, take a shower as normal and then get a clean washcloth. We want you to use half the bottle of soap, lather it well on the washcloth, and use it from the chin down. Avoid your face and your private areas because the soap can be irritating. Make sure to really focus on the joint that you're having surgery on. Make sure to get behind the joint, on the sides of the joint very well. The morning of your surgery, repeat the same process. Get a clean washcloth, the second half the bottle of the soap, lather it up, chin down, really focus on that joint again. Let's talk a little bit about the check-in process on the day of surgery. We want you to park in the north parking lot. And how you get there is you're going to go all the way to the end of Village Drive. At the end of Village Drive, it dead ends into a brick wall. Turn left into the parking lot. If you need to be dropped off at the front door, there is a roundabout for you to be dropped off. You will see on the doors, it'll say North Entrance, and there will be yellow writing on it. It is also sometimes called the yellow entrance. So park in the parking lot there. You will come through the doors. You will see a desk. Typically, there's someone at the desk that can guide you, but if for some reason there happens to not be someone, it's very simple. Just go behind the desk. There's a set of elevators. Take them to the second floor, and it opens right up to where you need to be. You will actually be checking in at outpatient surgery. We know it's not an outpatient surgery. That's just where everyone checks in. Once you check in at the front desk, you'll be taken to a pre-op room. In the pre-op room, you will have a nurse who will start your IV and start some IV fluids. You will get to meet with an anesthesiologist. Your anesthesiologist will go over their plan for you for your surgery. They will also ask you a million questions that you've already been asked before. What are your allergies? Have you had surgery before? You will also have another chance to see your surgeon. In this pre-op area is the time to ask any questions that you may have left about your surgery. You will also get a dose of antibiotics. These antibiotics are prophylactic antibiotics, which means they're to prevent infection. Everyone will receive some antibiotics before surgery and also some antibiotics after surgery. When it is time for your surgery to start, you will be taken to the operating room. Your family will be sent to the surgical waiting room. One thing that is very important, these surgeries typically only last from 45 to 90 minutes average. So we ask that the family wait in the waiting room. If you would like to get a bite to eat or something to drink, please do it after the surgeon comes and talks to you. Often the surgery goes quicker than the family thinks, and the surgeon comes out and there's no one to talk to. We want to make sure everyone has a chance to talk to the surgeon to get an update on their loved one. After your surgery is done, you will be taken to the PACU, or Post-Anesthesia Care Unit, also known as a recovery room. You will typically be here for about an hour to 2 hours. They're just making sure that you're waking up great from anesthesia, that your vital signs look good. If you have any pain or nausea, they will give you pain or nausea medicine to help keep you comfortable. When you're ready, you will transition down onto the Joint Club floor. We're the only inpatient unit located on the first floor. We consist of 26 rooms. All of our rooms are private. You don't have to worry about having any roommates here on Joint Club. But if you would like, we would gladly allow someone to stay the night with you. After your surgery, just let us know and we can help set up sleeping arrangements for them in your room. The number one priority on the floor is your safety. It is very important to us that you are safe and you do not fall after your surgery. You will hear us talk over and over and over about fall precautions. Our main fall precaution here on the Joint Club is if you need to get out of bed or even sit on the edge of bed, you must have a staff member. So please, please call us anytime you want to get up. If you need to use the restroom, if you'd like to brush your teeth, it is very important that you call us. Please call, don't fall. It is very normal when you first get to the floor for one of your legs or even both of your legs to feel very numb and heavy. You might not be able to move them or wiggle your toes. Don't be scared. That's very normal. Your legs go through a transition period. They start numb and heavy and they kind of transition to a tingly sensation, almost like when your foot is asleep, and then it'll go to a normal sensation. Everyone wants to know when your foot wakes up. But of course, I don't have the answer to that. It is very specific to each person. So typically, everyone's foot is awake by the morning. We try to get everyone up on the day of surgery. It really depends on how you're feeling, if your vital signs are looking good, and what time you come in the day. If you do not see physical therapy the day of surgery, you will be the first that they see in the morning, and it is early in the morning, usually around 7 in the morning. So everyone gets physical therapy very soon after surgery. Pain management is very important to us here on the floor. There are quite a few things that we use for pain management. They are very different for every person. So let's kind of talk about the different things that we use. One of the first things we use for some people is a PCA. The PCA hooks to the IV pump. It is a machine that has pain medicine inside of it, and how it works is you are able to push the button, and whenever the button is pushed, it delivers medication to you on a specific time frame. There's a very important safety aspect about the PCA that we need to discuss. No one is allowed to push the button but yourself. I'm not even allowed to push the button on the PCA. If we find out that someone else has been pushing the button, unfortunately we have to take it away, and this is for your safety. So remember, if you have a PCA, only you are allowed to push that button. If you do not have a PCA, you will still have the same medication available for you, the same IV pain medicine. You just will need to ask your nurse for it. It is very important throughout your stay that you keep an open communication with your nurse about your pain regimen. If something isn't working for you or it's making you not feel good, make sure to talk to your nurse with it. We have a whole slew of things that we can use for you, and we want to make sure you're comfortable. Typically on the first day, we use a lot of IV pain medication to help control your pain. And then the second day and thereon, we use a lot more oral pain medicine. We want to make sure that we can find something that works for you and will work for you when you go home. Some of you may have a pain ball. If you're going to get a pain ball, you will find out before your surgery from your surgeon or your anesthesiologist. This is a little catheter that will go on the nerve of your surgical leg, and it just drips small amounts of pain medicine onto that nerve to help dull the pain sensation. If you have a pain ball, you may have a longer period of time where your leg feels numb and heavy, where you can't quite wiggle your toes yet. That is normal. Don't worry about that. When we pull out that pain ball catheter, it'll wake up. A lot of people are interested to know, when can they eat since they've been so long without eating something? When you get to the floor, we will have ice chips and water here for you, so you'll be able to drink something right away. As long as you're not having any nausea after 30 or 45 minutes, you're more than welcome to have something to eat. Everything here is on room service. You will have a menu, and on the menu there's a phone number where you can go ahead and call and order what you want to eat. I have a recommendation though from experience. On the first day, please don't order the meatloaf or pot roast. It may sound like a great idea, but after you eat that heavy meal, you're not going to feel so great. So if you want to order something heavy, please wait till the day after your surgery. On the day of your surgery, keep it light. Soup, salad, sandwich, that'll be great for you. After having this surgery, you are at risk for developing a blood clot. So there are quite a few things that we do to help lower that risk and keep you blood clot free. First, we like to use these beautiful white hose right here. These are called TED hose. You will wear these for 6 weeks, 24 hours a day for 6 weeks. These are very, very important. You will be allowed to take these hose off for 30 minutes a day. They're kind of like pantyhose. They're a little bit thicker and a little bit tighter. You will wear these hose on both of your legs, and they come up to the thigh. We will give you an extra pair. Make sure you're giving your extra pair before you leave. To wash them, you hand wash, air dry them. A little trick we like to let everyone know about putting your TED hose on. They're kind of hard to get over your feet. So they come in a little plastic bag, or you could use something like a bread bag or a grocery bag. Slip that over your foot, and then you would just take the TED hose and just kind of scrunch them up like you would do a normal pair of pantyhose and slide them over that bag over your foot. Getting it over your foot is the most frustrating part because they're so tight. So once you slide it over, there's a little hole in the bottom where you can just pull the bag right out. That will save you a lot of time and frustration for putting these on. Remember, TED hose, 6 weeks, very, very important. When you're in the hospital, you will also use something called sequential compression devices. You will have one of these little cuffs on both of your calves, and they hook to a machine that's on the end of the bed. You will only use these while you're in the hospital and while you're in bed. Most of the day after surgery, you will be spending in the chair, so you won't have to wear these, but you will wear them while you're in bed. And how they work is one will inflate and deflate, and then the other will inflate and deflate. They take turns, and it's just to help keep that circulation going. Both the TED hose and the sequential compression devices just make sure that blood isn't pooling in your legs. It's circulating nice and well so that no blood clots can form. A third thing we use to help prevent blood clots is a medication. Everyone will be on some sort of medication here in the hospital and for a time period after to help prevent blood clots. After your surgery, your nurse will discuss with you what medication you'll be on and will give you instructions on what to do when you go home. In your hospital room, you will see boards in your room that are communication boards. They're for communication between nurses and you, physical therapy and you, and also between us staff members and your surgeon. So let's look at our main communication board. Here on the main communication board, you will see some of the basics of your stay. It will have the date, your room number, what your room phone number is. You'll see your physician. We will put your surgeon and your medical doctor on here so you know their names, who your nurse is, your nursing assistant. We like to put the day of surgery on here. We'll put what your procedure type was. This section right here is about pain management. We like to establish a pain goal. Here is a FACES scale. We will ask you a lot of times what you rank your pain at, and this is a scale that we use between 1 and 10. We like to put the name of the medications that you are on underneath. Right here also we'll let you know when you can receive your pain medication next. So you will have a time right here where you can call your nurse and ask. This section right here is completed by physical therapy. They like to rate how far you walked. Where it says bathroom needs, that's just communication with us about if you're allowed to walk to the bathroom or not, if it's safe enough. They'll let you know what group therapy time you'll be going to. Sometimes we happen to have 2. If we're having 2, they'll put the different times here. And equipment. This is just to let us know what equipment you have or that you need. Right here, discharge planning. Are you planning to go with home health or facility? We like to put discharge planning information here. And diet. Typically you're either on a regular diet or diabetic diet. If you have any other diet modifications, let us know. We'll put them on the board. Also, if your doctor changes your diet for any reason, this is how we communicate with you about what your diet is. This is your medication side effect board. You will see on here medications that you have been prescribed. Your nurse will review this with you as she gives you medications. On this side, you will see the trade name of the drug and the generic name of the drug. And the next column is the purpose. Why are we giving you this medication? And in the third column, you see side effects. It is very important that you always know the side effects of your medications. So you'll see common side effects on the right-hand side. You see this strip is in yellow. All the pain medications are in yellow. We will tailor this and make it specific to the medications that you are on. If you have any questions about any medications anytime you're in the hospital, please ask your nurse. The third board you will find in your room is your goal board. There are different sections of the goal board: diet, activity, treatment, pain management, and discharge planning and instruction. We just want to see you progress through these goals, and once you finally meet all the goals that we have set for you, then it's time for discharge. We will talk more about this board when you're in the hospital. So let's talk a little bit about your typical daily routine. So usually everyone wakes up very early. The surgeon's around early in the morning usually, and they're usually the ones to help wake you up. Physical therapy will come into your room. They will get you into the chair before breakfast, so around 7:30 in the morning. Everyone eats breakfast in the chair. Let's meet physical therapy and occupational therapy to help talk about the rest of your day with you.
Hello, my name is Dawn McClure. I'm a physical therapist at Northeast Baptist Joint Hub. I'm going to finish up where Melissa left off regarding your schedule, your daily schedule. After you eat breakfast, an occupational therapist will come by and help you practice with dressing and bathing. You will get dressed in your own clothes. After you are dressed, a physical therapist will be along shortly after to practice walking with you with a rolling walker. We will be with you at all times when you are practicing walking. However, we do not expect that your family members will have to be there with you when you go home. You will not need someone there to walk every time you walk. After your individual training with occupational therapy and physical therapy, you will then attend a joint class and in a group setting. This class starts at 10:30 and ends at approximately 12:30. We have a schedule here. We will start with exercises. These exercises can be found in your joint club book that you will receive at the pre-class or through your surgeon's office. We will go over the exercises in more detail and answer any questions you have about them. We do encourage you to start these exercises before your surgery date. We recommend that you do 20 repetitions of each exercise and that you do them approximately twice a day. This will help you in your recovery after surgery. Once you are done with your exercises, we will then proceed to the group class, the education portion of the class. During the education portion, we will review your safety protocols, your surgeon's protocols, as well as answer just basic general questions. It is very important that if you're going to have a coach or someone to help you when you discharge home, that they come to the class with you. And this is the perfect time, that 10:30 to 12:30 slot. If you want someone to just visit you while you're here in the hospital, it's best that they show up after that 12:30 time, around 1:30, so you will actually have time to visit with them. The rest of your morning or up until then, you will be busy with therapy activities. Once we have finished the education portion of the class, you will then have lunch. Your family is welcome to join you during the lunch portion as well. After you have had lunch, therapy staff, physical therapy, will practice walking with you again using the rolling walker. We usually try to get you to walk back from the classroom to your room. If you are planning on discharging that day, then we will get you set up for discharge. If you are going to stay with us another night, then we will make plans accordingly. If you are a knee replacement, we will get you in bed and on the CPM machine. That's a continuous passive motion machine. We will also be happy to go over with the setup and use of the machine with your family member or coach. If you are a hip replacement, then you will sit up in the chair, usually until after dinner. Typically, everybody gets up to eat dinner unless there's a safety concern. You sit up in the chair. Then after you eat dinner, you go to your bed. For the knee replacement, you will have another 3-hour session of the CPM, or continuous passive motion machine. For hip replacements, you can just relax, do exercises as you are able. During the night, this knee replacement patients will wear the extension boot. Achieving your range of motion after a knee replacement surgery is very important. Your surgeon will be providing some tools to help you achieve that range of motion. One of those tools is the CPM, the continuous passive motion machine. A lot of patients are scared of the machine, but as you can see, it moves very slowly and very gently. We will go over the individual use of the machine with you and your coach when you are here. Just some quick parameters that your surgeon would like you to follow. You will be using the CPM twice a day, 3 hours each time, for a total of 6 hours. It is best to use it on a bed or a stable surface, not on a sofa or a recliner or ottoman. You will increase the CPM 10 degrees each day until it reaches 120 degrees. You will continue at 120 degrees until you see your surgeon in 2 weeks. You also have another tool to help you achieve your range of motion. This is what's known as the extension boot. The boot is worn on the foot, and its whole purpose is to help straighten out your leg. You only wear this at night, and again, you will use it for 2 weeks until you follow up with your surgeon. At that time, your surgeon will discuss with you whether he wants you to continue using the CPM and the extension boot. Another important point to remember is that your leg is going to be sore and stiff, especially the muscles and tendons in the back of the leg. Sometimes patients are tempted to place a pillow or blankets under the knee to prop it up. Your surgeon absolutely does not want you to do this. This will only cause your knee to be stiff and cause you more pain. So you just want to have your legs straight or moving with normal activity. Nothing propped underneath the knee.
Hi, my name is Heather Thompson, and I'm one of the occupational therapists here on the Joint Care Unit. We're going to talk a little bit about your goals and our goals while you're here. Over the course of the 1 to 3 days that you're with us, we're going to be progressing your mobility. If you take a look, here is the activity board. These will be placed in each room, so you'll be able to refer to it once you get here. As you can see, on the day of surgery, you're going to be seeing your occupational and physical therapist. We're going to be assessing how you're moving and just basically getting you started. On day 1, we're going to be getting you up and assessing your mobility. We're also going to be establishing what your goals are. As you continue over the course of the next 1 to 2 days, we're going to be working toward gaining your functional mobility and safety. With occupational therapy, we're going to be working on your self-care. We're going to be having you use your rolling walker within the room to make sure that you can go home safely and independently as possible. For physical therapy, the goal is to attain about 200 feet using the rolling walker safely. You'll be working on stair training with your physical therapist if you have any to navigate within your home. All right, now let's talk about the equipment you're going to be using after surgery. You'll see here is just a standard rolling walker. This walker is the type that your surgeon has recommended. There are a variety of other walkers available on the market. However, this type of walker is specifically what your surgeon is recommending. You can see the rolling walker has the 2 wheels on the front and the pegs on the back. The rolling walker and the bedside commode are 2 of the pieces of equipment you can expect to go home with. The bedside commode is also known as a 3-in-1 commode. The reason it's called a 3-in-1 commode is because you can use it multiple ways. The 2 suggested ways that your surgeon has suggested you using this device is 1 as a shower chair and 2 as an elevated toilet seat. If you currently have any of these items at home, please remove them from storage and make sure they're operational and safe. If you plan on borrowing any items from family or friends, please do so ahead of your surgery date. If you have a rolling walker at home, please bring it in with you to the surgery. Therefore, we can set it up to your correct height. If you currently do not have any of this equipment at home, please do not run out and buy this equipment before your surgery date. We have a case manager on staff that's going to help get this equipment for you before you leave the hospital. All right, now let's talk about a hip replacement. If you have a hip replacement, you're going to have a couple extra restrictions following your surgery. For the next 6 to 8 weeks, you're going to have 3 precautions or movements that you're not supposed to do, okay? These will also be in your room, but let's talk about them now. The first one is not to cross your legs. So please go ahead and get in a habit of doing these activities before your surgery. The second one is not to pivot on that foot. Therefore, you don't want to step and do any excessive twisting on that new surgery leg. And the third precaution is simply not to bend over. The guidelines that we like to think about is the 90-degree angle of your hip. At no point do you want to be any closer to your knee than the 90-degree angle that's formed at your hip. Therefore, dressing and tying your shoes and things of that nature can be a little challenging at first. That's why I wanted to share with you a couple of devices that's going to help you through that transition period. It's very important that you take note of these precautions. Those precautions are in place to prevent you from dislocating that hip. Don't fret, these are not forever. They are until you're released from your surgeon, okay? So, dressing. You have a couple of things. This is called the hip kit. This is something that you will be purchasing additional. Insurance does not cover these items. So these are the only items that I would recommend purchasing before or prior to your surgery, okay? The first one is called the reacher. This item is very, very handy. It's very good for picking things up off the floor and also for dressing. Remember, no bending over, so you can't pick anything up off the floor or reach down for your feet for tying your shoes. The next item is going to be the dressing stick. The dressing stick is really nice for pushing off your socks and shoes at the end of the day. The next item is going to be the long-handled sponge. This is going to be really helpful for reaching your feet during bathing, because don't forget you can't bend over to reach your feet. The next item is going to be the sock aid, which is personally my favorite. This is going to allow you to put your socks on without bending over or having to cross your legs. The last item is going to help put your shoes on. It's simply called a long-handled shoe horn. All of these items come together in a kit. It's called the hip kit, and it's going to be very useful for helping you dress independently following your surgery. You do have other options for dressing. However, to do it independently, it is required that you use the dressing equipment aids. Other options are going to be having your family assist you with dressing. Another option is to simply not wear the items that require you to bend over or cross your legs. So there are other options. But again, to do it independently, you really need the use of the adaptive equipment called the hip kit.
The typical stay here in the Joint Club is 1 to 3 days. We do a lot of discharge planning to help you transition to your home safely. You will have a case manager that will see you in the hospital. They will set up any of the equipment that we discussed that you don't have. We will have it here before you leave. They also help set up home health and home physical therapy. Typically, everyone has home health and home physical therapy for 2 weeks, and then you transition to outpatient therapy. Outpatient therapy will be set up by your surgeon's office. On your discharge day, there are 4 people that have to discharge you before you can go. First is your orthopedic surgeon. Your orthopedic surgeon has to say that from a surgical standpoint, you're doing great and ready to go. The second is the medical doctor. You will have a medical doctor following you here in the hospital, and they have to say that everything else with you is okay and you're good to go. The third is physical therapy. Physical therapy has to say that you are walking far enough and safe enough in order to go home. If you have stairs in your home, don't worry, they will teach you how to do those as well. So you will be prepared to go home even if you have stairs. And the fourth that has to say you're okay to go is your nurse. Your nurse just wants to make sure that everything is set up, all the loose ends are tied, and everything is good to go. And then you will be able to discharge home. A typical time frame for discharge is between 2 and 5 p.m. The Joint Club class does end around 12:30, but often we have 15 people wanting to go home at once. So a realistic time frame for discharge, we say, is between 2 and 5 p.m. The nurses are very good at keeping an open communication with you. If they're waiting on something to be cleared, they will talk with you and keep you informed about your discharge. On your discharge day, you'll be given a discharge folder with a bunch of information in it. We like to just kind of go over a little bit of that information before surgery, just so you have a refreshed memory when you receive it. The first thing is showering instructions. You can take a shower when there is absolutely no drainage on your dressing when it is changed. Home health will be coming and changing your dressing, and they will help you make that determination. It is very important that you wait to take a shower until there's no drainage, because that tells us that that incision is nice and sealed up and nothing can get inside of it. The second thing that will be on there are the dressing change instructions. Your home health will be doing your dressing change, but we also send you home with the instructions and also materials to be doing those dressing changes for them. Driving limitations. Your surgeon is the only one who can clear you to drive. Unfortunately, if you're having a right-sided surgery, it's going to be 6 weeks. If you're having a left-sided surgery, you can talk with your surgeon about possibly clearing you sooner. Follow-up appointment with your surgeon. Typically, the follow-up appointment is 2 weeks after your surgery. You're going to need to call the office and make sure that that is set up after you leave the hospital. If there's any change and they want to see you sooner, we will let you know. Here in the Joint Club, we have something known as the Bloodless Medicine Blood Conservation Program. We will be monitoring your hemoglobin and hematocrit or blood levels very, very closely. You probably had labs done today, and we will be monitoring from here on out. We like everyone to be on the higher end of normal. If you're on the lower end of normal or anemic, we like to give a medication called Epigen. Epigen is just a medication. It's a synthetic form of a chemical that your kidneys produce that just tells your body to make more blood. Also, you may be put on some iron. So just know that we're monitoring that very closely.